Good morning and welcome to the second hour of TRAXX Momentum. It is a Monday, and as you know, Monday segments are called Health on TRAXX, where we bring you no-nonsense conversations so that we can enlighten you, so the masses, including you, understand better about your health. And to help us with a topic that we have today is Associate Professor Dr. Azlan Jaafar. He's the Dental Public Health Specialist at the Department of Periodontology and Community Oral Health at University Sains, Islam, Malaysia. And he's going to talk to us on how we can spot a fake dentist as opposed to a real dentist. Isn't that right, Professor Azlan?
Yes, sure, Anil.
Good morning. How are you today, Prof?
Fine, thank you very much. I'm very healthy today.
Okay. Great. I love your energy, and I'm sure you're going to enlighten all of our listeners. That's a promise, isn't it? At the end of this conversation, everyone would know how to spot a real dentist as opposed to a fake one, because, of course, we know that if we get or solicit help concerning our teeth from people, from anyone who is not qualified, that could lead to some long-term problems that, would snowball into something bigger, right?
Yes, I agree with you.
So Prof, maybe we can start off by drawing the parallel and identifying what are some of the red flags of a dentist who is fake.
Okay. First of all, we need to define what are the meaning of this fake dentist.
Sure.
Usually, what we know that person who are not qualified or does not have any degree in the in dental health, or a lot of faculty industry in Malaysia. Whoever who does not have this degree or certificate, or do not have this annual dental practice, for which most of us is actually registered with the Malaysian Dental Council, is actually we call it a fake dentist or quack dentist. Okay. In terms of how to identify these fake dentists, usually they practice their treatments, especially not in the gazetted area. For example, if you want to work to treat patients, usually we have gazetted places, and these places should be registered with the Ministry of Health. So whenever they don't have these places to practice, we definitely know that they are not original or authentic dentists in Malaysia. Okay. Where usually they work? Usually they work in places such as the beauty spa, or in the streets, or somewhere we're not really sure whether it is actually suitable, comfortable or not. So this is actually the first thing that we should know, whether they are truly dentists or not.
Right. Now, of course we know to become a dentist, you got to put yourself through medical school and earn a degree, and it includes housemanship and attachments and so on before you can be qualified to be a dentist. And it's pretty sad to know that there's some people who take the shortcut and then just stick on the label on their chest and say, I'm a dentist too. Why is this the case, doctor? What makes this profession, or this sort of trade, so accessible that people are able to replicate what dentists do, of course not at the same quality?
Usually, we know that there is a need, or we call it a lot of people, they want to have a very good treatment in it, and to treat their oral health. But because of the waiting time, or usually in the Ministry of Health, the waiting time for them to have the treatments, they have to wait for a long time, especially when they want to treat with the certain kind of treatment. And this certain type of treatment actually is not cheap. Okay, when they go to dental clinics, they want to have this kind of treatment, the charge is usually quite high. So they think that this actually opportunity for them to involve in this kind of professional or this kind of job, so that they can provide treatment which is affordable for someone who are not really understand or aware that this actually wrong and can cause a lot of problems. So this actually the opportunity for them, okay, so to involve in this kind of market.
Okay, okay. Thank you very much for shedding some light on that, Doctor, but Professor Azlan. Now that we understand that. Now I'm going to jump in for a quick break, but we're going to hook on our listeners to the aspect that we're going to touch on later after the break, which is to spot the real and also the fake dentist. Okay, we'll jump in for a quick break, Prof, and we come back. We shall resume with our discussion today. Today on Health on Tracks, I'm speaking to Associate Professor Dr. Azlan Jaafar. He's a dental public health specialist at the Department of Periodontology and a Community Oral Health at University Sains, Islam, Malaysia, and he's today talking to us about fake dentists. Don't go anywhere. Health on Tracks. We'll be right back. Good morning and welcome back to Health on TRAXX Momentum. My name is Anil on the mic, and joining us on the phone lines today, speaking about touching on the topic of fake dentists, is Associate Professor Dr. Azlan Jaafar. He's a dental public health specialist at the Department of Periodontology and Community Oral Health at University Sains, Islam, Malaysia. Professor, welcome back to the discussion.
Okay.
All right, so earlier on we hooked our listeners that we will be telling them how they can dichotomize and identify the difference between a fake dentist as well as a quack dentist. So, Professor, your expertise, tell us.
Okay, usually as a dentist, you need to register with the Malaysian Dental Council so that we are eligible to work within our premises. Usually what we do, we have to register and we are going to give an annual practice certificate. So this actually will be, we should put onto the wall of our clinic so that we actually professionally is a dentist and we work to treat all the patients. Okay, whenever you go to a dental premise, you should ask, do you have any dental certificate practice? Okay, and show us whether it is genuine or not. So usually we have two different certificates for the dentist. One is for the general practitioners, one is for the specialists. Okay, the color is actually very different between these two. The unique color for the general practice actually in the yellow color, for the specialist in the purple color or pink color. So
Right.
this should be display on in any places in the clinic. One thing, that's okay. Second thing, if you don't have, you cannot see, if they're not displayed in the area, you can always visit the Malaysian Dental Council website, where they have this, what do you call it, you can search for these practitioners, whether they are actually registered and active dentists that can work in their in the practice in Malaysia. So if they don't have, if they cannot provide you these two evidence that they actually is a dentist, so you know that they are not actually a authentic or a genuine dentist. That's how you can detect recognize whether they are a professional dentist.
Okay. So there are portals and there are databases available to validate and check the legitimacy of dental clinics that are operating out there in the country.
Yes, true.
Now, Doctor, this is a very important thing that we have to touch on, because sometimes to raise the awareness, as ironic as it may sound, we have to scare people out there and tell them, you know what, if you don't go and visit a trained, qualified dentist, these are the things that would happen to your teeth. And it would snowball into something even bigger. So let's take that approach and scare our listeners and let them know that if they walk into a beauty parlor, a facade that is operating on the pretext and then running a dentist inside and get some treatment for their teeth, what are some of the serious implications that they're about to face, Professor? Sorry.
Okay. One of the very scariest things, that we should inform to the public is that, you know that every single time when we treat a patient, we play with their saliva, with their blood, all these contaminated instruments that we use, usually for the dentist, they have this responsibility to sterilize all these instruments to kill all the bacteria and the viruses. So whenever you go and get treatment from the fake dentist, usually they don't do this, or even if they do, the equipment that you use is actually not is not safe.
So they don't use proper hygiene standards.
Yes, true. Yes. So that is a case where patients who did a treatment, they can cause these serious diseases such as AIDS, hepatitis B, and other kind of infections. So we worry if they don't really go and seek treatment from the authentic dentist, this could happen. That's one thing. Second thing, as we know that the most popular treatments, I call it seek by the public among the fake dentists, actually the braces. The one that they put they stick onto the tooth, and they move from the crowding tooth into the normal one. Usually, when we put all these brackets or this I call it these items inside the mouth, and we put the wire, and we ligate with all the items inside there. Usually, this will all the tooth will move to a certain area. So when the fake dentist apply that kind of things inside the mouth and the tooth suddenly move, we worry that all the tooth can be exfoliate from the tooth itself. Because why? Because usually when the dentist want to put on inside the mouth, they will know where to put and how the movement should be in the correct places. So if they don't put in the correct area, so this tooth can be exfoliate from the mouth. So that is the worry that should public known, so that when they want to seek a treatment, they should seek from the correct person. So these two things that is very, very important for the public to know.
Now, Doctor, another thing, talking about dentists, a lot of people, including myself, at one point of my life, I kept stalling my dentist appointment was because I feared of the excruciating pain that I would have to undergo when I was going to get my tooth extracted. Now, this is a long-standing perception, and I hope that you can bring us some good news. Has the advancements in dental technology reduced the amount of pain a patient would undergo when they get some dental treatment, Professor? Sorry.
Yes. So usually in all this kind of problems or a lot of complaint on pain, actually I always hear it from my patients. There is a lot of advancements now, and I believe that certain clinics, they actually have what we call it, invest in this kind of treatment. Okay, there are a lot of advancement in dentistry. Even we have then we call it needle injector that really have less pain compared to those days. Okay, and now a lot of the new coming dentists, we have actually teach them on how you can reduce the pain. Okay, when they want to treat all these kind of patients who are very afraid or anxious to the dental treatment. So don't worry, just come. We can help you to eliminate all that kind of perceptions. So you can have a very good moment during the dental treatment. No worry, just come and have this kind of new experience from the new coming dentist.
So there you have it, ladies and gentlemen, listeners of TRAXXfm. Our guest, Associate Professor Dr. Azlan Jaafar, has given us the good news that all of our dentists are trained so well that they can execute any form of procedure on your teeth with the most minimum amount of pain, right?
Yes, true.
Okay. On that note, Professor, let's jump in for another quick break. When we come back, we shall resume with our discussion. Thank you very much. All right, today on Health on TRAXX, I'm speaking to Associate Professor Dr. Azlan Jaafar. He's a dental public health specialist at the Department of Periodontology and Community Oral Health at University Sains, Islam, Malaysia. And he's been breaking things down for us on how we can identify a fake dentist as opposed to a real dentist, and some of the advancements in technology that have reduced the amount of pain that we will have to undergo when we pay a visit to our dentist. Don't go anywhere. Health on TRAXX. We'll be right back. Good morning and welcome back to Health on Tracks, right here on TRAXX Momentum with me, Anil, on the mic. Today, we're talking about our pearly whites and making sure that we visit the right people to ensure that our teeth get the right treatment, not from fake dentists, but from the real dentists, the ones who have been qualified and validated by the Ministry of Health. And to help us with and to understand this topic even better on the phone lines, I have Associate Professor Dr. Azlan Jaafar. He's a dental public health specialist at the Department of Periodontology and Community Oral Health at University Sains, Islam, Malaysia. Professor, welcome back to Health on Tracks.
Yes, I am.
All right, Professor. Now, there is a statistic that says that 4 fake dentists were arrested during operations to curb illegal and unlicensed dentistry nationwide, and that was between the month of June and December last year, and they were charged under a couple of sections which prohibits people who are not registered under an act from practicing dentistry. Well, that's okay. They would face the brunt for practicing it illegally, and we know what would happen to people who visit and solicit the services of such dentists. But are there any legal implications for people who visit these dentists? Will they be subject to any form of legal action as well?
Okay, very difficult question, Anil, I think. Okay, yeah, usually the person who will be charged is actually all the person who are giving the treatment. For example, like the fake dentist. However, for these people who seek the treatment, usually I don't think that they understand or they're aware that they are going and seek from a fake person.
Right.
Because I have patients where they come and get a treatment with me. They said that, it's actually they are fake dentists. Okay, I don't know. Okay, these kind of things that actually they don't know. Okay, they feel that anybody who can perform the dental treatment is actually we call it a dentist. So, in terms of charges, I don't think they will be charged upon them. But what we have to do is that we should keep awareness. We need to, we as a dentist or any dental practitioners, they should go out and tell the person like what we do now. TRAXXfm now. They distribute or they deliver all the messages about what should do and what should not.
So creating the awareness.
Yes, the awareness. True.
Okay, I have to say, Professor, you handled that difficult question really well. So I think our listeners have a good understanding on that. Now, this wouldn't be a Health on Tracks if we didn't pick on your expert advice for the benefit of our listeners. So maybe give us some tips and advice on how we can take better care of our pearly whites, and maybe just touch on briefly what are the risks, again, if we were to visit and solicit the services of unqualified or these quack dentists, Professor.
Okay. First of all, take care of your pearly white. Okay, inside the mouth is very important. Okay, I agree with you. Okay, that is actually you should. Okay, first of all, things that I think a lot of oral practitioners have come up with the idea of brush your teeth twice a day and using this fluoridated toothpaste. Okay. And brush it effectively, okay? I'm not saying correctly, effectively, because effective and correct is different. Effective means that the dentist will show you what the effective way on brushing, okay? Before, when you wake up in the morning, and also before you sleep at the night. And do not eat a lot of sugar. That's very important, okay? Why? Because I think everybody knows that brushing is actually the most important practice or hygiene practice that people should do, okay? And a second thing is that go and seek from a qualified or authentic dentist. Second. And last one, okay, that's important. How you should know that whether you are going to see the one who should treat you or not. Okay, always go and seek treatment to the registered premise, okay, dental premise, and always look to the recognition, okay, certificate from the Ministry of Health. Okay, just go and find all that kind of display. Okay, if you see that they don't have this one, they just have this one, okay, ask them. Ask them whether they have registered with Ministry of Health or not, or if they don't say that, I don't have. Okay, say okay, it's okay. I'm not going to go and get chemo from you. That's the tip that you should go do before you get and have a treatment.
Okay. I think it all trickles back down to us being diligent and performing our due diligence to ensure that we, get help and, receive treatment for our oral health care from a qualified, personnel. But just to pick on one thing that you mentioned, Professor, brushing your teeth effectively and correctly. That was pretty interesting. And I hope that maybe just briefly you can elaborate a little bit more on that. How do we brush our teeth effectively? That's something new for me. Effective versus correct, huh?
Okay. Well, the difference between effective and correct is that usually, you feel that you have brushed correctly, right?
Yeah.
You brush rounded as have been informed in a lot of advertisements or in YouTube. Okay, you brush rounded everything.
I even do something that is not. I brush the back of my teeth really, really rough.
Yes. Okay. That's the problem, because you don't want to peel off your teeth, right? In fact, when you brush very hard, all the hard tissues on your teeth also can become out. Imagine, you use the same toothbrush and you brush your teeth.
Right.
Try to brush the floor, hardly on the stained floor. What will happen on the stain? They will remove.
Wow, Professor, what a metaphor. Teeth and the floor.
Imagine the same thing when you brush hardly on your teeth. What will happen? You will remove the surface on the tooth. That's why people feel that I should brush hardly using a hard or moderate or medium toothbrush. That's actually they're doing falsely on the tooth. What we do is that we should advise patients to use a soft or ultra soft bristle, brush effectively. If you want to do it effectively, you have to come and see us. I always teach my patients on the effective way of brushing. I will teach you, I will show you the correct way, and I always monitor. You come back and I will see whether the important to remove the plaque is actually removed, or you actually remove the tooth that shouldn't be removed.
Wow, so you can tell whether someone has been brushing their teeth effectively or correctly. Wow.
Not only me, all dentists. All dentists. Yes, all dentists.
Wow, don't fool your dentist. Your dentist knows if you're doing things right, huh, Professor?
Yes, cool.
All right, Associate Professor Dr. Azlan Jaafar, thank you so much for spending your time with us on this Monday morning. You enlightened us. It was a fruitful discussion, and I wish you the best for the rest of your day. Thank you very much, and hope to speak to you again soon. Thank you.
Thank you very much, Daniel. Welcome.
All right. And that was a wrap for today's edition of Health on TRAXX. I just had a conversation with Associate Professor Dr. Azlan Jaafar. He's a dental public health specialist at the Department of Periodontology and Community Oral Health at University Sains, Islam, Malaysia. And I think some of the key takeaways from that conversation is for us to brush our teeth effectively and not correctly. And don't you think you can fool your dentist, because they're all trained to identify that. Jumping in for more break music, and when I come back, we'll be breaking away for the 12 o'clock news.